Good morning. Our group will present the main hospital department and their functions. First, I will explain the general structure of the hospital. A hospital is divided into inpatient and outpatient areas. Inpatient areas are for patients who need to stay in the hospital for treatment or observation. For example, we have the medical ward where patients receive medical treatment and monitoring. We also have the surgical ward, where patients stay before or after surgery. Another important unit is the intensive care unit. It is patients who are seriously ill and need continuous monitoring and specialist care. In contrast, outpatient areas are for patients who do need to stay overnight. They come to the hospital or for consultation, examinations, or procedure. So the hospital works and the team as a team. Patients are sent to different departments depending on their condition and medical needs. Now my classmates will explain the emergency department and critical care.
Regarding urgent admission, the emergency department operation 24 hours a day. Its main functions is to reach patients with acute or serious medical condition. First, patient go through a triage process. Triage main evaluation per scan according to the severity of their condition. Patients or more serious condition receive attention first. For example, a patient with chest pain or difficult breathing may need immediate medical attention. The hospital also has the intensive care unit or is ICU. The RCU is for critical person who need continuous monitoring and specialist treatment. Now, main classmen of Spain the diagnostic and outpatient service.
Diagnostic and outpatient services in contrast to critical care units. Diagnostic departments support overall clinical decision. One important diagnostic service in radiology. Radiology uses imaging procedures such as STRUSH, ultrasound, cord scan, and ME to help doctor identify medical condition. Important service in the pathology laboratory. It analyzes blood, urine, tissues, and other samples to help diagnose decisions. The hospital also has a patient clinic. Patients can visit this clinic for medical consultation, follow appointments, and some procedures without studying overnight. The disease service help doctor make accurate diagnosis and choose the best treatment for a patient. Now my classmate will explain the surgical suite and patient flow.
Finally, the surgical suite is dedicated to operative procedures. Before surgery, the patient is prepared and evaluated by the medical team. During the surgery, the patient is monitored by different healthcare professionals. After the operation, patients are transferred to recovery room, where are monitored while they recover from anesthesia. Depending on other condition, patients may they go to a surgical medical ward to ICU. The process is called patient flow. It means the patients move between hospital departments according to their medical needs. To include cut hospital department was an important function, and they must work together to provide safe and thank you for listening.
To apply these concepts clinical, let's use follow patient present with abdominal pain. First, the patient arrives at the emergency department and goes through triage. After the initial evaluation, the doctor requires diagnostic test. For example, the patient may be referred to radiology or an ultrasound or CT scan. The result helps the medical team determine the diagnostics and decide on the appropriate treatment. If the patient needs surgery, they are transferred to the surgical suite. After surgery, the patient goes to the recovery room and later to the appropriate hospital ward. This example shows how different hospital departments work together to provide continuous patient care.